Some parents in western Montana are wondering if their child is going to come down with pertussis, commonly known as whooping cough.
Health officials tell us the number of cases in Missoula County has doubled in just a few days. Both health and school officials say they're concerned with how fast the disease has moved through the community in just a short amount of time. Connor McCauley looks at how they're attempting to stop it.
Confirmed cases of pertussis or whooping cough have doubled in Missoula County since last week and has affected everyone from adults to children as young as 4.
On Friday night, the numbers in that outbreak doubled from 7 to 14 confirmed cases. And in investigating for contacts, looking for people who may have been exposed to those cases so they can be notified and take precautions, those numbers are approaching 500 contacts right now.
Pertussis is very contagious, often going airborne and infecting an unsuspecting person. Since it spreads so quickly, health officials are trying to identify people who have been in contact with an infected person.
This is a respiratory disease, so it's spread by respiratory droplets. So sneezing, coughing. A contact is basically defined by someone who spent enough time in close enough range to the contagious person. And for this disease, that's about a 3-foot zone. So you can see your desks are within a 3-foot zone, and an hour cumulative time. So you get a lot of that type of exposure in an institutional setting.
MCPS schools already have had confirmed cases and are working with the Missoula County City Health Department to keep it from spreading.
When we are informed by the health department of a student carrying any kind of disease that we need to be concerned about, they notify us, and then they have a very formal procedure, which we do together, to identify who might be in the pool that would be affected by that individual, whether it's a staff member or a student. They need to be interviewed to see if they have symptoms, and they need to be referred to a doctor to either get tested or potentially just to get preventative antibiotics just in case.
Florence schools are also dealing with an outbreak and have been working with the Ravalli County Health Department to contain it.
We sent 20 kids home, so then then we're going to continue to do that process and elimination of who's been exposed, who's had direct contact. We've actually had a staff member who was exposed. We're going to continue to follow the protocol and follow the processing and testing kids and sending letters home and making those recommendations. And that's how we'll continue going forward, is that the health department nurses were up at our school helping our nurse get everything taken care of and do the testing, and we'll just continue with that process.
The health department says it's crucial to get tested as soon as you're feeling symptoms. If it's not treated early enough, this disease can linger a lot longer than it would if you got treatment immediately.